Welcome to everyone who has joined the webinar tonight. My name is Jennifer Winter, owner of Pedicare Professional Foot Care Instruments located in BC, home of the Rototool brand of instruments, as well as other foot care instruments and supplies, and distributor of the ToeFX system. And tonight I'll be co-hosting the webinar with Dr. Rit Van Ham from ToeFX, and we have special guest speaker, Patrick Shields, joining us from Saskatchewan, and he's the owner of Footworks Advanced Foot Care. And he'll be sharing his experience with integrating fungal nail treatment into his foot care practice. So we're really excited to have Patrick here with us this evening. So to get started, this is a webinar that we will be on for anywhere from sort of 45 minutes to an hour. And so we'll be going through, Rit will present some information to you, and then we will turn things over to Patrick to share his insights and valuable experience. And we will also be, if you have questions, we have a Q&A component of the webinar. If you have questions, feel free to ask them with the Q&A functionality on the webinar. You can ask those questions, and then we can actively incorporate them into the discussion. And we've run a few of these now. Chances are, if you're on this webinar, you've probably attended one of the other ones that we've hosted in the past. And so we see these as a continuation, so a continuing discussion about fungal nail treatment. And so you may see some information that has been presented on previous webinars. It's really just an overview in the off chance you haven't seen it before, because we think it's just so important that we want to cover it off again. And so you will see some information that's been shared previously, but then we're adding on new information and adding on new experiences from different practitioners. For example, obviously tonight, Patrick sharing his experience with everyone, so you can build on your knowledge and get the perspective of different practitioners and see what works for you within your foot care practice. So other than that, housekeeping wise, this is a recorded session. So just so you know that, if anyone who is joining us will also receive the recording of this, and then anyone who's registered will also receive a recording of this webinar after the fact. And then at the end of the webinar, in that follow-up email that you receive, there will be a discount code included from Pedicare to you as a thank you for joining our webinar. So there'll be more details about that in the follow-up email that you receive. So to kick things off, without further ado, I will roll things over to Rit Van Ham from ToeFX, and she will share some information with you before we talk with Patrick. And maybe, I don't know, Patrick, do you want to do a little bit of an introduction before, or do you want to wait for your intro? What do you think?
I could say hello now.
Okay.
Hi, I'm Patrick. And as she said, I've been nursing for about 10 years. My background is mostly emergency, and then kind of fell into the game of foot care, opening up a private clinic. So, and incorporated the ToeFX into that system of care, and it works really well. So looking forward to the webinar tonight. So enjoy, you guys.
Awesome. Thank you, Patrick.
Okay, so I will start with a few slides just to set the stage for our presentation tonight. So again, thank you everybody for joining us. Today's topic is we are going to focus on fungal nail treatment, and the goal of this series of webinars are basically to provide practical steps for setting up your practice, and I see it as continuous, as Jennifer said, from the previous webinars that we did, and to the many more future webinars that we are going to bring to you. Just a bit about ToeFX. If you want to know more details about the cost and things like that, please feel free to approach Pedicare. Basically, the return on investment is pretty low. You need only about 2 to 3 patients to cover the initial cost of ToeFX. In the email that you're going to get after the Zoom, so I invite you to join our training. We have 2 levels of training, level 1 and level 2. For now, the level 1 is provided for free. It's about 1 hour on Zoom, so I really encourage you to do it if you haven't done so. The main topics that we are going to, or Patrick is going to discuss today, is the visual appearance of the nail. The visual appearance of the nail tell us a lot, and it's really important to look at what we are dealing with. So just a little bit about it's important to know where the infection started from, if it's distal or proximal, or if it's only superficial infection. Sometimes it's also nice to know and important to know if it's a candida infection. Candida looks different than dermatophytes. However, TOFX can treat both. It's also important to look for signs of tinea pedis on the skin. Often tinea pedis is the initial cause, or this is where onychomycosis start from. I always encourage clinicians, and this is what we are doing in our clinical studies, is to assess the severity. Assessing the severity is important because it will tell you the prognosis. You can communicate it with the patient, and you can kind of estimate how many treatments you need. If it's a mild case, you need less treatment. If less treatments, if it's a severe case, you will need more. And there are 4 criteria that define the severity. It's total area of the infection, proximity to the matrix, thickness, and patches. If it's and there is a formula to calculate the score, but anyways, it's not that important for the purpose of this webinar today. But I just want to go over quickly about the different criteria that define the severity. So area of involvement are divided into 4. If it's distally and only 25% of the nail, it's a score of 1. If it's all the way to the lanula, it's a lanula, it's score of 5. Again, to the proximity to the proximity also contributes to the severity of the nail. And also lastly, and I think Patrick is going to touch upon that, is patches. So strikes or patches are often indication of accumulation of fungus and accumulation of keratin, and it's often takes longer to treat, and they need to be tackled mainly with debridement. So if you see a patch, it's really, really important to tackle this area. Patches can be sometimes indication of spores, and spores means that there is basically colonies of fungus that have another layer of membrane, and they are more protected than regular colonies of fungus. These are few examples of strikes or patches, which are indication of spores. And if you see sign like that, it's telling you that most likely it's onychomycosis, and especially those corners are often harder to treat. These are few examples. This is tinea pedis. This is a common appearance of infection that caused by Tacophytum rubrum. Here are a few case studies. This is lateral onychomycosis. This is a typical yellow due to a Tacophytum rubrum infection. And this is, for example, is a dermatophyte Tacophytum infection together with secondary bacterial infection. Often, or it's common that mainly severe cases can cause to secondary bacterial infection. So what I really wanted to say that one picture is worth 1,000 words. and I encourage you to take a picture of the nails. Often it's easier to see what's going on with the big toe. So if the big toe is infected, it's easier to see what's going on. So you should take a really high quality picture and look on it, even if it's on your phone, zoom in and see all the small details that are telling you a lot. This was my part. And now I'm going to give the stage to Patrick. So Patrick, the floor is yours.
Well, thank you. Hello, everyone. Yes, so we incorporated TollFX into our clinic about a year ago and kind of never looked back. It's worked really well for us. We've had close to about 15 to 20 patients that utilized this treatment and have had all successful. So it's quite a useful product to move forward and treat that nail fungus that comes into your clinic or into the homes that you go to if you're going to be doing it at home as well. It's very useful there. So the one thing that Rich and I talked about before was basically just that with in treating the nails, debridement being a very key focus in preparing the nail and getting it set up appropriately for the serum and for the light to be utilized to treat the fungus and try and stop it in its tracks, basically. So we've had several patients come into the clinic. So this is one of our first ones. This was more of like a ram's horn nail and with the underlying fungal infiltration underneath. So with each treatment, we continue to keep removing fungal debris and debrided underneath the nail itself, deep into the corners, and make sure that you can get right as far down as you can and remove as much material as you can and to really saturate with the serum so it's highly effective. This lady came in and was treated for roughly 7 months, almost 8 months. And we can see by the next slide here, the results of her nail today. So this is the typical difference. Even the patient was quite shocked. And it really speaks to why you would take pictures at the very beginning and throughout the treatment, because they are key. Because you can tend to continue to treat and just see the progression of the healthy nail and kind of, you can almost forget a little bit of what it started out as. So we went back and went over the photos and she was quite stunned, like quite surprised of what it looked like and to what it looks like now. So it really, I think as we spoke, the debridement is kind of key in treating the fungus effectively. So if we go to the next slide, this lady came in as well. So we can see, and I pointed out here, kind of noticing about 3 different ways that the fungus infiltrates the nail. And to me, in a simplified way, is it seems like it's either interlayered throughout the nail because it is so compacted and it's, as you said, you have a high OSI score for that, or they trap right into the little corners and that's where they start and try to grow up the sides, or the one that's deep underneath the nail and is trying to push it off the nail. So this one, I see a lot of these ones just kind of at the start that are deep into the corners. And in order to effectively, we found getting rid of this infiltration to be as effective is all about the debriding down into the corner, along the cuticle line and deep near the matrix here to remove the fungus and expose the deeper part of the nail right at the base of there. Because we did notice as we thought we were treating the fungus and debriding it, removing it, that once we kind of ground back underneath the cuticle line and just pulled the cuticle back to expose the nail, that you could see the fungus was still trapped deep into that little corner that you really need to gently debride back into that corner to remove all that fungus out of there to treat it. So we started doing that this is one of our first patients, especially treating fungus nail like this. And on the next slide here, you can see right there, as we continued and treating this and using the TollFX, right along the cuticle line, you can see that you can expose the nail and see now the nice pink line of nail that's coming in that's not being infiltrated with fungus. Above that, it appears to be infiltrated, but it's actually more of a dead space that we've killed the fungus in there and it's just a bit of damaged nail. But we continued to treat that until that piece grows off the nail completely, and was evidence that it was officially completely gone. And that worked a lot faster, just to make sure to get deep into that. Those corners worked and was very effective in that way. We had another gentleman that came in. I think it's our next slide.
Patrick, sorry to stop you.
Yep.
How did you file down this area in terms of using, which burrs did you use, and how deep did you go? How do you know? Because we see many.
It was a very fine tipped burr, which I'm sure has a number on it. So maybe Jen can tell me. But it was just something that could penetrate underneath the line of the cuticle line that was just very, very thin. And I just debrided back and forth gently enough to kind of remove that space and remove the thickening in that corner.
Here?
Yeah, so because it's so close to the matrix, it can get a little tender. So you don't want to be leaving your burr in there or debriding too long, and be aware of the heat that builds up. And just kind of gently remove the debris. I kept spraying with a bit of alcohol spray, just some 70% spray, just to kind of remove. And I think that's key too. If you moisten the area with a bit of alcohol, you can see the nail and see the line very clearly. If you're just kind of debriding and leaving all the dust and settle and that kind of stuff, you just get more of a matte look to it. And you can't really see it very well. So.
And Patrick, was it a diamond or carbide burr that you were using to debride? Do you recall?
Either or. I think it was diamond I was actually using. Okay. But I mean, carbides, even ceramic, I mean, you could use whichever. It just depends on how you want to utilize the heat. But I found the diamond one that I had was just the fine tip that I wanted to get underneath there, just to clear it away without really damaging them or hurting them in any way.
And you don't reduce necessarily the other part of the nail down? We would
reduce, we would use a little bit of a thicker burr underneath to kind of clear a bit of that material under there. I would use a curette and clean a bit underneath that little area, and just any of the debris, because I do note that when the Toll-Effects kills the fungus, it turns to like a flaky powder. And then you kind of know that this is just dead material that you're removing. It's not that spongy, soft fungus you can just feel the difference. It comes out and it's just like a powder that's it's just dead material by that point. Then we clear that off, and then once that little area is cleaned out, then we would just soak it again with the serum and continue with the treatment. It does, I think, I'd mentioned before that a little bit of the nail that's deadened on there that doesn't have any really active fungus going really holds the serum in a little bit better too, I find, for myself. And this next gentleman is, this is where it has a good visual of, we went right down in along into the deep corner underneath the nail layer, and basically removed deep into that corner of that stained, obvious fungus infiltration in that corner. And this one, you had to be gentle because we went quite a deep debridement there, that you just don't want it to get too hot or cause any pain when you're doing it. But this one worked really well about removing all that fungus out of that corner. And then the next was, after several treatments, then we can see that the fungus isn't infiltrating anymore. It's just nice new pink nail that's coming, but we kept treating until it completely grew off. And talking to the patients and saying that same thing to them, I said, well, it looks like we've killed it, it's gone. You know, they have that confidence, like, thank goodness, because they are very tired of having the fungal infection. But then saying that the treatment still continues, we still use the serum until it grows off and we can trim off a nice new nail. And then we know it's completely done, so it doesn't reinfect or cause any problems like that. So. And they're usually, patients are very comfortable with that. It's like, yep, keep going. they're all in once they can see the results like that for sure. And the next gentleman, he's one of my more recent. This is one of the gross, like score 36 or 35, because this nail was huge. It was the podiatrist would debride it down without any other option, just so he could wear his shoes, just for comfort. So it was a buddy of his that actually sent him in, say, try this, and we went ahead at it. And this is kind of where you see that nail, it's all infiltrated in layers, and there's little pockets of polis, and it seemed to be protected in a layer of keratin. Like the fungus would be hard to get rid of because it's just trapped in this, almost like a cocoon or a little cyst on the inside the nail. Until you debride it down, it could and remove that material and get down to the basics, so that the serum could really penetrate that nail and take care of the fungus. So so in the next slide, you kind of see.
So how did you, what was your approach here? Did you file down the whole area, or?
So nippers, we took a lot of stuff with just nippers, just kind of getting in there and just taking the pieces off that were not attached there. Clearly, I mean, they were just, we trimmed quite a little bit. And then more of aggressive, you could use more of a ceramic or a thicker burr here to really, because you really are you're removing a lot of damaged and infected nail that you're just, it's time. This would speed up your time and just kind of getting down, and then switch over to a more finer burr where you can get some, more particular debridement done to really get into those tough little spots along the base of his cuticle line there. There was some really good, once we took this piece of nail off, that it was quite deep and along there, that it was a finer burr, or a finer tipped burr was much better. So, and it's, to me, I could say use this one, that one, this one, but it's your preference. You know, it's how long it's going to take. Some burrs take a long time, but they're a lot finer, and I like to use a smaller tip burr because it starts becoming an art project a little bit, just so it can kind of look nice for the patient as well too. So on the next slide there too, it was underneath this piece of nail that there was a good pocket of soft nail fungus that was in there, that if you just kind of, the typical treatment of just having it debrided so it'd be comfortable, it just always came back. He was dealing with this for, I think he said 5 years he's been dealing with this. So we took a lot of dead nail. His opposite nail was on his left big toe, was a little bit different. It was more of those lateral fungal lines that you can kind of see, that we could treat and bore out in just a completely different way. But this one here, after about 4 months of treatment, he was just in today actually to our clinic. But on the next slide there.
And Patrick, before we move to that next slide, so that picture that we're seeing there, that's post debridement?
That's post, first layer of debridement, and then I took a second picture. So to be honest, if these pictures might be a little backwards, if we go to the slide before this. No, that was before. Okay. So the second slide, just at a different angle. Okay. Noticing this one, and then we took that, where the arrow is there, we took that center piece off because that was no longer attached. And underneath there was a very soft packet of fungus there. So it kind of, I wanted to show this one to show that don't be afraid to get in and under and go searching a little bit. And he had no pain, no nothing. It's a dead portion of nail that it didn't cause him any discomfort or anything. So it's that kind of get in there and get the chunks out of there and the bad nail off. And that'll be the most effective for the treatment, because like after 4 months, he's back now. That on the next slide there, you can see quite a remarkable difference for his nail now. So where the arrow is there, that's all brand new nail. It's all nice and pink. It's hardened up again. Even on his second toe, that kind of speaks to that. debridement into the corners and getting down low into those corners. These ones can be a little trickery because they're so tiny to try and get in there and get that stuff out of there. So, but they do respond really well to the same kind of debridement for that. So he was back in, again today, and he's very happy with the outcome so far. He's very excited for flip-flops. So
that's amazing.
Yeah.
There's some feedback coming in saying that's incredible for one, and it is. But then also going back to the debridement and just a question asking, so would they take away every bit of affected nail, pretty much getting right down to the nail bed? Is that how would you also respond to that, as far as, is that always going to be what's done, or what are the limitations to that much debridement before proceeding with treatment or application of serum, I guess?
I found for myself, if you don't mind,
No.
for practical application, it is unique to each nail and kind of how you approach it. Like I said, the nail on his left foot of his great nail here is it's obviously most likely the same fungus, but the way it affected the nail, completely different. So I find by treating the fungus underneath the nail and having that serum be held by the nail that you have on top, is helping them to keep the serum under there and work so much better. And you can, when he comes back, we just kind of take out the debris and pull and cut back on the nail, and take out the debris and cut back on the nail. And we're down to the last layer of affected nail it's basically killed off. So it's working good for that nail, but it's completely different than what we're doing with his right foot. So sometimes you would take the nail right back down to the nail bed, careful not too low, because that's when it starts getting things a little tender. And the other thing I would add to this is, if you did get low to the nail bed, similar to this one, when it grows back, to really focus your attention on redefining the nail line when it comes in, because the tip of the toe will callus right along that line, and then you might turn it into a graphotic nail by accident because it will stall the nail and get trapped. So you'd have to make sure you're kind of encouraging that nail to move forward as you're treating it along the way, I found.
So how do you do that? How do you encourage you mean that you encourage the growth of the nail?
Yeah. So I just make sure that I kind of pull back a little bit of the skin underneath the nail line as it moves forward, so it doesn't
Here?
match. Nope. Right along the distal end of the nail.
Oh, here.
Here. Because right along there, it's all calloused, and it would just get trapped and stuck in there.
Oh.
And has a difficulty in moving forward. Then it starts will end up piling up on itself and start becoming thickened. So as we kind of do that, we just make sure that the callus is taken down on that edge, and then I define the line with just a curette even. So that can be a little tender for them, but it helps kind of speed the nail to growth too. So it works really well for what I found.
So I liked your approach, actually. So here, what you meant is that you didn't take the nail all the way down. You did it. You put the formula through this pocket.
Mm-hmm.
You apply the formula here.
Yeah, and then this piece end up coming off afterwards. I'm pointing into, like, you can see my cursor, you can't. But yeah, that.
Here. Yeah, here.
Yes.
There's a question and comment about debriding underneath and leaving the nail intact. And I'm just responding and saying, and Patrick, you can speak to this, that's unique to this specific client, that's the way it worked out, that there was that intact piece of nail that you could apply the serum, but that's not always how it's going to be. That's kind of a unique situation.
Yeah, it was unique to the way that is. There's a couple other nails that do that too, but it's only because the nail has been removed from the nail bed itself already from the fungus. It's just a way of, you usually have pulled out that fungus already, and then you're just kind of what I do is saturate inside and underneath, and it was kind of a little bit of a forced compliance to the serum staying on, and it worked really well for this client and one other one. So there's another technique you can use, but or you can dive right in, and if they're okay with the other one was more of a aesthetics. they were happy to go a little slower, but they didn't want to have their nail completely removed. And so we worked around that a little bit. So
That makes sense.
Okay. You want to, before we move to other questions that we wanted to ask you, Patrick. So, Jennifer, do you feel that you want to ask some questions from the audience, or you want to keep it?
Yeah, that would be great if we could do that now. There's a few that have come in. We've answered some of them live already, Patrick, while you've been discussing, but there's a couple others that are sort of unrelated to these specific cases. One of them is, did you recommend to clients to change footwear and socks once they started the ToeFX treatment?
yes, not necessarily change, go out and buy new, but definitely clean and sanitize their area at home, shower mats, things like that, places where you'd be transferring it to other family members, to check other family members as well. I mentioned that when going home, is check even kids' toes or anything like that, that maybe they don't mention anything. We don't inspect our kids' feet all the time. So, and just those kinds of things, just but to recommend buying new shoes, they would be up to them, but definitely something about sanitizing in the way of trying to prevent reinfection for sure.
Okay, and did you give them any specific tips for sanitizing that you recommend?
Something if you can find, usually we have a place in town where you can go and they have a almost like a Virox shampoo, I guess, or soap you could use, hand washing, that would be an antifungicidal, an antiviral, and antibacterial all around soap, and just kind of soak it in that to kill everything off. Probably the fastest way would be buy new shoes, but
Yeah.
not everybody can.
Yeah, that's certainly a financial decision people need to make too. Yeah,
Sure.
certainly there's sprays and different shoe deodorants that have sort of antifungal properties, like the Poto Expert shoe deodorant. There's different things like that people can try in connection and collaboration with doing the ToeFX treatment. So
we're limited sometimes, being a clinic that's we don't prescribe anything, of course. So you're limited to what you're suggesting and what you're moving on, so you can ask for other expertise, but usually something general. And then I usually say just burn their socks.
Yeah. That's great. A big bonfire of socks. That's what I'm envisioning right now. So, okay, let's see what else we have in here. So, have you had any patients that have had, this is a question from the audience, any patients that have had involuted or pincer nails that are fungal and used ToeFX, and has it helped in that specific situation?
Yes, yes, and yes. So other great products, I think, from Pedicare too, is Onufix. So we used for involuted and ingrown nail. I have one lady that I'm treating right now for all three of those things. So they ingrow, we're trying to straighten them out. But the thing is, they're involuted and ingrown because of a fungal infection. So they've just the way they've pushed this nail off and turned it into this big involuted dome. So we're trying to slowly kill off the fungal infection and cleaning out the debris as the nail grows, flattening it, and just kind of taking care of any ingrown corners that show up along the way. So it's kind of a threefold. So it works. It's working great.
And what's this? What's the sequencing of that? Did you start with one treatment before how did you figure out the ordering of what you were going to do?
Well, we started off with treating in clinic for just general nail care. She was in a bit of denial about it being fungal. As her first appointment said, it's not a fungus. I'm like, okay. So I'm not if you say so. So kind of as time went on and just more treatments and what we were pulling from her nail and stuff, that I said, we should probably reassess this a little bit. I think maybe this could be a fungus. So we started off with treating the involuted nail. I said, and helping a little bit with any ingrown corners as they, like the pincer nails that would come with this. So she was having good relief from that. I said, but we might not get it as flat as you want because of what I believed was a fungal infection. I said, but we could send something away, or we could just start treating it. What do you think we should do? She says, let's go ahead and give it a try. She didn't opt for having it sent off again, or having a sample sent. I said, we can totally do that, even through ToeFX themselves. So, but she said, no, let's just go ahead. So, and then we just did that. So we we continue on with the Onifix bands, and then treat with the Toafex at the same time. So
Okay, that's
until
great.
the Onifix bands are obviously in, every 6 weeks, 8 weeks kind of thing, but the Toafex still is every 2 weeks.
Okay, that's great.
Yep.
A couple other questions here. So there's one here about if you have onycholosis form, I think it's saying from the distal 50% to the middle, and then the rest is onychomycosis. So just saying there's two different things going on the same nail. How would you approach that?
I think that's Irit's corner.
Yeah, I think you're right. Do you see that question in there, Irit?
Yeah, I think it's I think it's important for me, in order to answer it, to see the picture, to have more details. I think it will be very difficult to distinguish between the two of them. And also, I think the approach is always to, to treat the onychomycosis, and then the dystrophic nail will disappear. So I hope I answered the question.
Okay, that's great. A couple easy ones. Is Toafex available in the US? So at this point, no. Irit, do you want to speak to that one?
We are working on it. I think we'll be in the States in about 6 months or so.
That's great.
So we'll keep you posted.
Okay, that sounds good. There'll be an update for sure once that's available in the US. So there are some other questions here, but maybe we can dive into the specific questions that we were looking to have answered yet, and then anything we don't answer throughout that, then we can go and do a quick Q&A at the end before we wrap things up, if that sounds good.
Sure. Yes.
Okay, great. All right. You're gonna do that? Okay, go ahead.
No, you go ahead. Yeah.
Okay. So these are questions for Patrick. We wanted to make sure that got covered off, because we know from the previous webinars there was a lot of discussion around, how do you actually incorporate it into your practice? And so the question we're looking to have Patrick answer is describe how you incorporated Toafex how he incorporated it into his foot care practice.
So basically it stems from your initial appointments, and that's kind of where you will start. They come in, they're going to see you for many different things, and generally, what they think is going on with their nails and what's not going on with their nails could be just confusing to them, and they think, like the lady I had who said it's not fungus, because she was just either misdirected or got that whichever bad treatment, it doesn't matter. So it's just from those initial appointments of saying, this is what we think it might be, because it's always by assessment, suggesting to go and get it tested, and kind of dive right into explaining the differences of Toafex and its non-toxic application compared to other treatments. Generally, I have found that 90% of the people that are coming in and looking for this kind of treatment are asking already, do you have anything that treats fungus? And then we can basically explain the differences of Toafex compared to other really toxic methods of oral medication, and the commitment that's for other topical treatments, that this is one of the best ways, that it's non-toxic, it's every 2 weeks, you can fit it into your schedule, great results, and just kind of sell it along those lines as you're doing your first initial assessment. And so it incorporated really well, and it's very successful. So we've grown passively with it, as I was mentioning before. So we didn't launch a huge ad campaign, but it's still quite, we get the message out there, and it's and people are very receptive to it. So it would be an easy add to your practice for sure.
That's great. And then the next question, Irit. And you did touch on this. So presenting Toafex to your clients, what has been the best strategy for presenting it to your clients when they come into you with what you know to be toe fungus?
I usually start off by making fun of their feet, saying how yucky. No, basically it's the conversation is just, if I see is there any concerns with things that present with their nails? And I said, just the conversation just kind of works well passively, just to say, because it's an embarrassing thing and people don't like to talk about it, which is understandable. So you kind of passively approach that could be this is something we could do. And it works really well. The cost effect kind of outweighs, I think, useless things that they do purchase and try to attack it with that just aren't as effective. So we do kind of talk about that in our clinic a bit, saying this is an effective method. So, you'll get what it's worth, for sure.
Yeah, and there was a discussion that came up online here about combining other topical treatments with toe effects. And that probably speaks to some of the products that you're referencing, that we're not mentioning anything specifically. But I know I read during a previous webinar, there was a discussion about, comparison of treatments and combine, is there a need to combine with any other treatments? And my response to that one, and you can speak to that too, Patrick, would be with toe effects, there really shouldn't be any other topical treatment applied. What are your thoughts on that?
Yeah, I would say obviously not, because we've had results either way. The things that we suggest in our practice is for Poto's nail tincture, because it has a bit of an antifungal in it. So generally, once the time limit of the 3 days is over, and they're able to just wash it off, I say use the nail tincture in between appointments. Just to give it an extra little boost and an extra little, antifungal in between each time, and they're happy with that. And I think it gives them a bit of ownership to their treatment as well. They feel like they're being a part of the process, that works really well. And whether I've seen, I don't know if it worked. It seems to work really well. So
yeah, it's a very popular product, certainly inside or outside of a fungal nail treatment, just to improve the texture of the nail. So even if they in combination with to improve the texture outside of their treatments, it can be a great
and it gives me some confidence that they're maybe using something actively at home, that there might not be, like you said, for reinfection or shoes or their socks, or there's something that's causing or could have caused it, that they're maybe helping stop that or something from that home. I don't know. Could be just wishful.
I just wanted to add to that. So while there is no contraindication between toe effects and other topical or oral medications, as Patrick said nicely, the efficacy of toe effects is high enough. It's around 76%. So there is no need, to my view, to apply together with other treatment. And also, there is one issue or concern that come to mind when you ask for the patients to do too much at home. There might be, unless Patrick, you are not in agreement with me, but might be an issue with compliance. So what's nice about a treatment that is done for the patient at the clinic, so everything is done for them. So you don't rely on their compliance. So this is my point of view.
Yes, I think the more, yeah, that's great. Yeah, I think the more you can control the treatment, then the better the outcome, versus something where a client's applying it daily, then we're relying upon them. So, okay, so the next question here, any challenges? So it's always good, everyone wants to, we talk about a lot of the positives and what, the benefits are and the effectiveness and all of that. But it is also good to counter that with any challenges that you may have faced as you were incorporating that into the practice. I think that's valuable for the attendees to hear as well. So Patrick, on your end, were there any challenges you faced as you incorporated toe effects into your practice?
The one actually just popped into my mind before we spoke. The challenge is the convincing the client of its, like you said, the efficacy of this product, I think can be a challenge, because they're usually dealing with a fungus that's been going on for several years. They've had no effect with anything else. They've used toxic oral medications and felt awful, and they're ready to, like, oh yeah, here's another thing. So I think trying to convince the patient of that it's that you really need to make sure that you're well read into the product and be able to explain it very well. So I think that was the challenge, to be able to relay back to the patient that they could understand of how effective it is. And then usually after about the 3 months, they're seeing the good results happening already, and then it's much easier after that. So I think that was one of the ones that I had to make sure that I was educated and smartly in delivering the product and its clarity to some of the patients that are going to be of all varying different ages and understanding. So like anything we do as nurses and treatments and stuff is good patient education. So
For
I
sure.
think that was a good one.
Anything? Sorry,
no,
go ahead, Patrick. Oh, I was just going to say, certainly we're getting questions here that are coming in, and this might be a good time to speak to
Sure.
that, is how you charge your clients, and any what you've had to overcome, or how you've overcome any objections from clients in regards to pricing.
So the biggest thing, and as far as for charging of clients, is there is a range. There is a range of the cost and effectiveness that this product, but you kind of have to read your room. For us, where we are in southern Saskatchewan, we are one of the few practices that offer and utilize TOEFX, but it's a little new technology kind of, and a little bit different, and for cost and pricing. So we charge a little cheaper than most places, I think, than across the country. But I mean, that's, you have to understand your clientele. I mean, and there's a good, it's very good at explaining a good price range, and to deliver the product effectively in your clinic and make it viable. I mean, you are doing this to help get rid of fungus, but also to make it profitable for your clinic or your practice as well. So
Yeah, to give an idea, pricing across Canada per treatment ranges somewhere between 70 and 130, depending on where you're located. So there is sort of a range of pricing that is suggested. And that's a great point, Patrick, as far as the training goes. Irit, when you do your initial training for TOEFX, speaks to that. And there's a lot of that information that's covered during that initial training that you can access at no charge. And so that's information that will be provided in the follow-up email as well. I'm just looking, there was another question here specifically to pricing. It had to do with, and Irit, maybe you know this, in terms of any provinces at this point that are covering TOEFX as a treatment.
Yes. Yeah, I don't have this information in front of me, but it's covered under some insurances. I don't think it's province specific, but it's insurance specific. So I know that some clinicians, some patients already managed to cover TOEFX under their insurance.
Okay, so people, clients would have to check with their private insurance to see if they can get coverage.
Yeah,
we've had some of ours covered as well. Generally, I mean, anything under a cost or a health spending account covers everything, obviously, because it is anything health related. I made a good point before. If you start for some nursing foot care coverage and including the TOEFX into the nursing foot care coverage, there might be just a blanket cover cost similar to massages. They would cover $40 a month type of thing, and might be able to just incorporate to get some money back that way too. So I think I've had one that's been successful with that as well.
So under foot care,
yeah. And we're having good conversations with insurance companies actively right now, and our clients pushing back on their own self to say to insurance companies, why isn't this covered? So stay tuned.
Okay, that's great. And there was a question, would this be considered advanced foot care? In your practice, do you consider this to be advanced? Yes.
Yes.
That's great. There are several other questions, but how about we continue on with these questions that we have here, and then we'll come back to those. Any other advice or feedback you would give to someone looking to incorporate? So someone who knows of toe effects, they're interested, what would your advice or feedback be to someone looking to incorporate this into their practice?
Be patient. Because it's a timed delivery of care. So we find the good effects really now boosting into our clinic because we've been going about a year and we've had, a ton of successful patients. So those patients all go out and say, you have to go to Footworks. They have the toe effect system and it works. Including your podiatrist. If the podiatrist clinic nearby or the podiatrist you have is not incorporating this as a treatment, get in touch with them, maybe connect with them and say, if they would support this kind of treatment, and they might refer patients over to you, that kind of thing, which is something that helped our clinic as well. So, yeah, I would just say be patient. It is very effective and it works really, really well. And I think after you have a good, a bit of a promotional campaign behind it, I think it'll just pay for itself. I think you'll be very happy with it for sure. Yeah.
That's great. Yeah, there's mention in one of the comments here about a specific podiatrist in an area who is going out of their way to make it difficult for the foot care nurse using toe effects. So I hopefully, and there's many podiatrists who provide toe effects treatment. So that's also something that can be mentioned, that they're foot care professionals, foot care nurses, chiropodists, podiatrists. There are several types of practitioners that are offering toe effects treatment. So hopefully, like you're saying, the podiatrist who's local, who might not be providing it, is open to that type of relationship.
Yes, it's positive here.
Yeah, that's great. That's great. That's great to hear.
Yep.
I think that was the end of the set questions, correct?
Yes, correct. Yes.
Okay, perfect. So we do have a few different questions that have queued up, and I just wanted to put it out there. Patrick, there's some time sensitivity to his availability, so we're going to squeeze in as many of these questions as we can. So Patrick, are you ready? It's a speed round.
I'm ready. Okay,
great.
Speed rolling. Let's go.
Okay. So advanced foot care we covered. Offering this as a mobile mobile treatment option. I know, Patrick, you have a clinic, so speaking to this as a mobile option.
Easy, as long as you have a plug-in. I mean, it's basically that easy. So we've done in-home patient appointments. The thing that you're going to be dealing with is it's a time thing. So it's 15 minutes soaking with the serum and making sure that it penetrates the fungal nail, and then treating with the light. So you're going to be invested in that in-home appointment. But I mean, if you adjust your schedule and what you're doing, it's totally workable for sure. Yep.
And I can speak to that too. As a distributor, we have several customers who are mobile foot care nurses, and they are having no issue incorporating this into their practice. As you said, they just, you make some adjustments, make sure you have a power source, and obviously set expectations with your clients for the amount of time the treatment will take. But certainly, as far as size, the size of the lights is not very big. The serum packs are not very big. So portability wise, there's no issue with porting the system. Yeah.
Same going into care homes, whatever. Yeah, it works well.
That's great. And so then next question. So sometimes after deep debridement, we generate minimal bleeding. Do you think it can help to eradicate the fungus faster because of the contact with the blood? Harit, do you want to take that one?
It's not advisable to cause injury. If it happens, it's okay. You just need to make sure that you disinfect the area, and actually the formula will help with that. But it's not a best practice to do it.
Yeah, trying to avoid versus we're not encouraging that. So and then next question, what does OSI stand for?
It stands for Onychomycosis Severity Index.
And so anyone who's on this call will get a recording of this. You'll be able to refer back to those slides. You may, if you missed the initial part of the presentation, you may not have seen those slides, but you'll be able to go back and listen to Arit and her explanation of that. So that one is.
And I, by the way, I wrote a paper about OSI. So if you're really interested, feel free to reach out and I can gladly send it to you.
Oh, that's great. And there'll be a contact slide, contact information that is at the end of this presentation, as well as in the follow-up email that comes out. Okay, next question. My concern is selling in terms of cost. Do you have any suggestions for how to present it as affordable? We did cover that, and then healthcare benefit coverage. So I think we did cover that one off. Patrick, anything else additional you'd want to say there in terms of cost and affordability?
The thing I think that helped me too is, I mean, we touched on cost and affordability, but I think then we switched. If you switch the conversation over to how easily it works into their life, because it is every 2 weeks. It's a 45-minute to an hour appointment every 2 weeks. Sometimes a little bit less if you don't have to do any extra debridement, that kind of thing. Whereas other ones are, like we said, the oral medications are so terrible for you, and then other things are a daily application and that commitment, and that's why it fails. So, and now you can, I mean, you speak, it's what they want out of the end of it, and kind of touching on that. It's like, you can speak to, are you ready to just maybe be done with this fungal nail and get rid of this infection? Something does need to be done. Funguses aren't good to have on the body, that kind of thing. So generally how you present the conversation, it could be more to the therapy, the treatment, and the ease of it. And then branch over to, so for whatever price you come up with, $60, $65, $75, whatever, and that it's really quite affordable for the treatment. So
that's great. That's good advice for sure. Okay, let's sort of, the more questions we answer, the more questions we're getting. Okay, in BC,
you're delaying my supper. No, I'm just kidding.
we're so close. So getting correct diagnosis for onychomycosis, talking about sort of an inability to obtain that. So I have asked the patient to obtain the lab requisition and will collect the specimen for them. Local podiatrist has gone as far as to say treatment does not cure. Any ideas of how to circumnavigate or how to get around this kind of negative feedback? In terms of testing, do you have any of your clients test, Patrick?
Not really, no.
Okay. Arit,
no, we usually be, I mean, the conversation is always there via the assessment. The assessment usually comes very clearly, usually when you're adjusting or even touching the nail, debriding it a little bit, or using a curette to move some of the material. It's obvious to what it is. It's a soft, there's an odor to it. We can send it. I've mentioned we can take a sample and we can send it away. As Irit said, there's through SoFX themselves, they have a lab there that they could send it to. I mean, we can do a collection and that kind of thing. So it's offered to them. Generally, they're like, yeah, they'll be bothered or they can't be bothered, because it's usually by the assessment you can tell. I mean, we're not diagnosing, as I said, but you can tell usually by the assessment that it's one comparatively to either it's onychogryphosis or onychomycosis. So if it's a thickened nail because they dropped a can of soup on their toe, that's a little different, but generally it's quite evident by the color, the staining, the smell, everything that kind of incorporates into that. So they generally just say no, but the offer is there and it's explained to them quite clearly too.
I just wanted Diane to add quickly to that. So we have on a research basis a PCR. So you're welcome to send us samples. We basically need a very small amount. And it will tell for sure if it's onychomycosis or not. Also, we are developing AI, so artificial intelligence based on a picture. So it will tell you to a very high degree of certainty if it's a fungus infection or not.
That's great. it sounds like that's a missing link in some of this. So that's very
Yeah.
exciting. And then the next question, in terms of in clinic only, or can it retail to the client? So this is a system that has to be applied by a healthcare practitioner. So foot care nurse, podiatrist, chiropodist. This is not an at-home treatment for clients. It can be done in their home by a foot care professional, but is not a take-home treatment. So we talked a bit about Poto Expert. Certainly the shoe deodorant or the healthy nail tincture, those are things that your client can use at home on their own, but not toe effects. So we answered that one live. And then clarifying, debriding the nail to the nail bed each time, is it required? And we did touch on that, but can I surmise that to say that it's not required each time? It is dependent upon each situation. It really depends on the nail.
Yeah, I would agree. It's by each appointment. Generally, the methyl blue is very tenacious to stay on the nail, just how people take care of their nails and clean them. So you're going to be doing some mild debridement probably in every appointment, just so you can visualize the whole nail anyway, just to get some of the excess blue off that's left over. But going deep into the nail bed, that last slide for that gentleman, several appointments had to go deeper into there because it just exposed more spots and more areas where fungus was hiding. But it's your best call. It's your judgment, definitely, for your care.
I wanted to add about that. If you see that, so often with severe cases, the fungus actually is in the nail bed. So this is where it resides, and this is why you want to go all the way to the nail bed, because you want to make sure that you treat the fungus from the core. But it's a case by case study. If it's not that deep, the infections, so it's not needed to go all the way to the nail bed, but depends.
Okay. And then going back to the testing, there's a couple questions there that we can cover off quickly. A cost associated with the testing, Arit, and then also where those samples are actually sent.
So for now, the cost for the testing, the PCR is free because it's not commercialized yet. And if you want us to help with that, please email me at irit@toefx.com. Here I can share the slide. Anyways, it's the address that you see on our website. So it's in Hamilton.
Okay, that's perfect. And then another question: would you prep the nail using urea 40% prior to debridement? Patrick, any comment on that?
No.
Yeah, no.
No, generally just you prep the nail with a little bit of 70% alcohol spray just to kind of cleanse the area and dry it up a bit. Then the work is in the debridement. For
sure. Yeah,
that's your initial step. And then now you've got the place where the magic happens. The serum and the magic lights.
Awesome. Yeah, no, it's that debridement is huge. And we did have another webinar on that. That was our first webinar, actually, was very deep into the weeds on debridement. So if you haven't seen that one, certainly seek that out. Okay. I guess this is a kind of specific one about introducing it to clients in long-term care and what the protocol is in terms of obtaining an order from a physician. Have you run into that, Patrick?
You don't need an order from the physician to move forward with, because in long-term care, only basic foot care is covered usually in long-term care, not advanced foot care. So it's generally from family driven. So it's whether the family, being the decision maker, wants to go ahead with that. And then generally, if it's afterwards, they say, well, we would like to get it tested and do that. That's when you would cross the threshold a little bit of, before you take a sample and that kind of thing, might need a physician's order or a podiatrist order to say go ahead. But generally it's the families included you in the treatment process. Then again, you can take a sample and send it to TOEFX, to the PCR, and have it tested and come back, and you can obtain those results even. So because it's falling under your advanced foot care treatments anyway. So
We by the way, did a very successful study, almost completed in one of the long-term care in Ontario. So basically, foot care nurses, basically the management of the long-term care often do not treat patients they don't have staff for that, so they use third parties. And it's 100% okay to use TOFX in long-term care. But as Patrick said, yeah, it's need to be, I think, a consent from the family, something like that.
That's great. Now, Patrick, I think Arit and I could tackle the rest of these questions. I wanted to make sure that you don't miss your event. So
I appreciate that.
Okay, so I wanted to thank Patrick so much for joining us tonight. You've been a wealth of information, and I know that you've helped answer so many questions that the audience has. So thank you for sharing your time and your expertise. And I feel like you might be getting some people sending you some follow-up questions. But
and that's I was going to say, please, you can go to our website, or I don't know if we've added an email. It's footworks879@gmail.com. If you want to forward on some more questions, things like that, or just some advice, please reach out, and I'll do my best to answer as best I can.
That's amazing.
Thanks for the invite, and enjoy the rest of it, and see you, everyone.
Thank you, Patrick. Enjoy your dinner.
Patrick.
Thank you. Okay, bye-bye.
Okay, bye.
Bye.
So there were a few more questions here. So there's one: how is TOFX supplied? So Pedicare is a distributor of TOFX. So we stock the lights and the serum, so they can be ordered in. There's 3 different packages available that can be found on our website at pedicare.ca. And so you can order a starter package, and then we stock the serum. So as you're using the system and you work through the serum that's in your starter package, you can then reorder the serum from us as well. So you can order online, or you can order from us directly. In terms of lights, there's a comment here about getting 2 lights. So the packages that I mentioned with 3 packages, 2 of the packages are 2 light packages that come with your 2 lights and serum. And then the other package is a single light package. And so it's definitely best to have the 2 lights, because you work so much more efficiently with 2 lights. You can do both feet, treat both feet at the same time. A 1 light package is there as an option for a practitioner that really wants to get into using TOFX, but maybe can't afford the 2 light package, but it does slow down it does make your treatment time longer. Or would you say, does it double treatment time? I guess it depends on the prep.
Yeah,
Yeah, so you have your prep time, and then you have your time with the lights. And so you're not necessarily doubling treatment time, but you're doubling the time that they spend under the lights. So just something to keep in mind when you're considering your package. How many layers of formula do you apply?
So you apply minimum of 3 layers of the formula. So the nail needs to be really saturated with the formula.
Okay, so you'd go across the toes that you're treating 3 separate times.
Correct.
Per treatment. Okay.
Yeah.
Okay, that's great.
So you treat all 5 toes, even if you treat, of course, the infected toes, but if there are some toes that are not infected, so you need to debride them slightly and also apply the formula just to avoid cross-contamination.
Okay. And then where will I find refresher teachings? So I guess this is talking about if you're already using TOFX and getting refresher training.
Then if you refer to refresher training, so yeah, of course, we offer that. Feel free to approach us, and we'll send you the link so you can book a refresher.
Yeah, if you're an existing user and you're feeling like you need more information, certainly that is something that's available to you. And then, do you use a separate consent form for regular foot care to use TOFX?
Because some of the clinicians are using separate consent for TOFX. Because you are taking pictures, so you want the patient consent to take his pictures. Also, my point of view that on every treatment that you offer, you should have a consent. It's good to go that way.
Okay, that's great. And then the last one, go ahead.
Sorry, basically the consent is to set up expectations. So you explain in the consent what the treatment entails, what you're going to do. So you wanted to make sure that the patient understands all the different steps.
And I have seen some consent forms where it incorporates sort of any treatment option that could be offered by the foot care professional. And then that section gets filled out if and when you provide that treatment. But yeah, you have to sort of decide within your practice how you want to structure your consent forms. And then the last is more of a statement, just talking about burrs. We had a discussion without burrs without getting too specific, just because that wasn't the topic for tonight. But someone did mention Tyane burrs being great for debriding, and absolutely they are. So the Tyane burrs are the blue coated burrs, and that blue coating provides an amount of heat reduction as you're debriding. So certainly when you're working with debriding a fungal nail, anything you can do to reduce the heat, whether it's with a Tyane coated burr or a ceramic burr, is a great way to reduce that heat as much as you can. So that was a great comment by Margarita. And then what would be the best disinfectant? Oh, let's see. Best
to clean the lamp between patients.
Yes, thank you, Arit.
So so you basically can use any disinfectant wipes. You don't want to spray the light, because there are some electronics in there, so you don't want to make the light too wet, but wipes are perfectly fine.
Okay, that's great. So those were all of the questions. Whoa, we got through all of those.
Yes.
Those are all the questions posted. Unless anyone wants to raise a hand or ask another question. That was great. It was really a very interactive group. I loved all the questions, and having Patrick here to be able to share his wisdom with us was fantastic. And oh, sorry, I saw a hand raised there for a second, but it looks like it's gone. Oh, no, hold on 1 second. Oh, it was just a thank you. Well, thank you to all of you. Thank you for joining us tonight. We enjoy doing these. Arit and I are really enjoying doing these. And it's just great to hear the conversation and questions that everyone's asking and their level of interest in toe effects, but also just generally in debridement, fungal nail treatment of all kinds. And so look forward to future topics, and any suggestions, feel free to send them our way. Arit, I don't know if you wanted to put up that I don't know if that final slide is still up with contact information or not.
So I just also wanted to add that we are trying to bring interesting content and webinars to you. So if you have topics that you really want us to discuss, we can look. We have connections, so we can have a look and can see if we can bring another guest speaker, but we are open to hear from you about topics that you would like us to share and discuss.
Yeah, that would be great. So you can reach out to Arit or myself with any of those suggestions. And then, as Arit had mentioned earlier on, there will be a follow-up email that comes out. That follow-up email will include a link to the recording. It will also, Arit will include a link to how to sign up for introductory training for toe effects.
Yes, it will. Yes.
Okay, perfect. And then will also be a discount code in there for a $20 off your next pedicure order for orders over $200. There'll be a link, a coupon code that will be included in that email as well. So thank you so much for joining us tonight. We look forward to our next webinar. We'll probably take a little break over the summer and then regroup in the fall with another topic. And yes, please reach out to us with any questions that you might have, and otherwise have a fabulous summer. Thank you so much.
All the best, everybody. Thanks for joining.
Take care.